We are a conference that's talking about diverse ways to help improve healthcare capacity in Ukraine. I next want to invite Nelya Melnitchouk to talk about an electronic solution, an app, potentially to help people care for those affected by the war.
Thank you, Andrei. So I am back, and I actually feel really bad going after Haley and after such an impactful talk that Haley gave us. And it's always, usually the people who are organizing the conference get like the spot somewhere where probably it doesn't fit this presentation. But I had to argue for this 5 minutes, and I will not tell you everything what our organization is doing. But one thing that I wanted to tell you a little bit about this mobile app that we created, and it's created by Ukrainians in Ukraine, utilizing IT team, utilizing Ukrainian physicians and Ukrainian expertise. We are just providing an advice here. But the reason why I wanted really to tell you about this, because I actually think that this is going to be an important tool for all of us to function together, because we are all working on education in Ukraine and capacity building with our small little silos. All of our academic institutions, people who are going on mission trips and bringing this expertise to Ukraine. What happens afterwards, that expertise remains local. So for example, people from Ivano-Frankivsk Hospital will talk to people from, I don't know, Mass General Brigham on WhatsApp chats, on Telegram groups, on Facebook messengers, and that expertise, even though it's shared, it is not shared with everybody else in Ukraine, whom it could be. So we created this mobile application. It's called Heal UA. You can find it on App Store and Android Store. And it's to connect Ukrainian physicians with each other for peer-to-peer consultations, but also with their counterparts abroad. It's HIPAA compliant. It's moderated. We are utilizing AI translation because that was our issue at the beginning. The app has been around for about 3 years, but in the past it was always in Ukrainian, and we had human translators which were not as effective, but we just implemented AI translation, which is moderated. And I will not, because I don't want to spend too much time, I'll just tell you how it works. So physician in Ukraine can put a post on an app asking a question. It can be longer question, shorter question. They can upload the images. It has to be without the name. We moderate for that. And then many of us can chime in and provide the answer. And we're also moderating that. We don't want some answers that are not evidence-based to be propagated, so we're keeping an eye on that. And as I said, it can be done in Ukrainian and English. So in Ukraine, actually, it's now utilized by 4,500 physicians. We have 98% response rate to clinical cases. And so far, we had 500 cases have shared. And we have multiple collaborations worldwide, but we really want to make sure that this group is utilizing it as well for mission work, for courses work, for communicating afterwards, and for sharing the expertise. Because the most important thing was this app, that knowledge that's there, then others can learn from. We can read clinical cases, and we can learn from that. And we were chosen to be Clinton Global Commitment Makers this year. So our commitment was to grow this app to 12,000 users in the next 2 years, to implement this translation which we have done, and recruit more international experts to help. So please share with your community. Please come and talk to me about that. Our Ukrainian team made sure that I really need to tell you about it because they're very passionate about it. And we know that despite reading multiple books, reading the guidelines, without talking to each other as peers, it's very hard to manage patients. We are very fortunate in academic communities in the United States. For example, I ask my partners questions every single day about management of the patients, but Ukrainian physicians actually might not have that ability. We heard from Alexander Lychevsky, who is actually one of our advisors on the board of advisors for GMKA. We know that expertise is very limited. And, but the good thing in Ukraine is, and I think we all have seen that, the young physicians, they're hungry for that knowledge. They want to talk to others. They want to learn from others. So let's utilize this app to provide expertise for them. So if you want, whoever does not have it, download it utilizing that QR code, and speak more to me about this. We also had a fancy video about the Heal UA, but we will skip that in the interest of time. But I would encourage everybody to use this because those young Ukrainian physicians really depend on that, and the patients as well.